Good morning from the West Coast. Good morning, everyone. Thanks for joining us today. Day 4 of our Health is Wellness Week. Good morning. Hi, everybody.
Good morning, Nicole.
Good morning, Stanley. How are you today?
I'm doing great. And we want to thank you all for joining us for day 4 of Health is Wellness Week, presented by Minorities for Medical Marijuana. Today, we have a very special case for you. We have a very special episode for you. In today's episode, we're going to be spotlighting multiple sclerosis. So I'm sure you guys have seen the acronym MS, or for different companies or organizations or support groups. And today we're going to be getting in depth about multiple sclerosis with a multiple sclerosis warrior, as well as a physician who's assisted patients suffering from multiple sclerosis. And I know you're asking, well, I've heard of it. I've seen the charity walks, but what is multiple sclerosis? Multiple sclerosis is an autoimmune disease which the body eats away at the protective covering of the nerves. The eating away of these nerves disrupts communication between the brain and the body. Well, how does this affect these patients? So I'm going to read you some of the information that I found regarding multiple sclerosis. Multiple sclerosis causes many different symptoms, including vision loss, pain, fatigue, and even impaired coordination. The symptoms, they differ in severity, complexity, and duration from patient to patient. So there's no one case that reflects all cases. Some people may be symptom-free most of their lives, while many others may have chronic pain and chronic symptoms that never actually go away. Why is this important? Because your central nervous system, which is all the nerves and bundle branches that go throughout your body that connect to the brain, that control every single organ system. So from me lifting my hand to me having the ability to use my voice. And that is why we want to spotlight multiple sclerosis for today's episode in coordination with our Health is Wellness Week. My co-host, Ms. Nicole Buffon, has some additional information regarding multiple sclerosis that she wants to provide for us. So Nicole, tell them what you found for them.
So we know that we picked and selected very carefully the diseases that we were going to discuss this week, the autoimmune diseases that we were going to discuss this week, based on how they affect communities of color. And so historically, it has been thought to primarily affect Caucasians. Multiple sclerosis has, particularly those of Northern European descent. However, breakthroughs in research have revealed more information about MS in other racial and ethnic populations. Studies of military personnel and subscribers of Southern California Kaiser Permanente healthcare system both indicate a higher incidence of MS in those in the Black community than previously thought. Being Black with MS carries unique challenges and experiences, from scientific and clinical differences in the disease itself to inequities in the healthcare system and more. Of course, the Black MS Experience program series is an opportunity to connect with others who understand the distinct experience of life with MS as a Black person. The live Black MS Experience Summit virtual program was held last week on the 22nd and the 23rd. All program sessions and resources are available on demand until December 31st of this year. You could find that programming and its resources on the National MS Society. NationalMSSociety.org you'll be able to find all of those resources at that on that website. So please check them out. There have been numerous studies conducted to evaluate the effects of cannabinoids on MS-related pain, spasticity, and bladder symptoms. These are some of the symptoms that occur frequently in patients with MS. So I would like to read to you what the National MS Society says about using cannabis. I found in the research all this week, all these different national societies, this one was the most progressive. The National MS Society supports the ability of people living with MS to make informed choices about their treatments with their MS healthcare providers, including the use of medical cannabis. Recognizing that additional research is still needed, we are evaluating ways we can remove the barriers to allowing research on medical cannabis at the federal level. We advocate legalizing medical cannabis at the state level. This is one of the best statements that I have found so far. Everyone else claims that there's not enough research about cannabis with MS, and even quoting or citing research that has been done with synthetic cannabinoids and synthetic medicine like Marinol and Dronabinol. But I was really impressed with the National MS Society.org is where you'll find this information. I was really impressed with their statement and how much they support more research at the federal level and support advocating legalizing at the state level. So kudos to the National MS Society.
Thank you for that information, Nicole. So, ladies and gentlemen, the information that Nicole just provided you is showing that we have national organizations that have voiced their opinions and support for medical cannabis. And with that being said, I would like to introduce our guests. Our first guest is a patient, a survivor, and an MS warrior, Ms. Philandris Frazier, a native of Alabama who has been here in Georgia for the past 10 years. He is a true embodiment of what a MS warrior is, as he's used medical cannabis to combat his condition. He continues to participate in advocacy, education, and he's really active in the community. Our additional guest is Dr. Rashaan Hodge, who is an Atlanta MD. I'll bring up information as well. Dr. Hodge is a native of New Jersey. Dr. Rashaan Hodge received his Bachelor's of Arts in Psychology from Morehouse College and earned his degree cum laude from the Robert Wood Johnson Medical School, graduating in 2002. Dr. Hodge completed his internship and residency in family medicine from the Morehouse School of Medicine in 2005. Upon completion of his education, Dr. Hodge matriculated into family medicine and served as an investigator on numerous clinical research studies aimed at making a human connection better for patients suffering from different conditions. His compassion for those in need continued to be evidenced as he led several hospice programs throughout Georgia as both medical director and assistant medical director. Volunteering community services are important to Dr. Hodge as he dedicates countless hours to giving back to the community while offering many services for free at times for those financially strained and in-home visits for patients who are not physically able to consult or treat at his practice. I know that Dr. Hodge has been very active in the advocacy and legislative process here in Georgia, and he was a key figure in moving our medical cannabis programs forward. Currently, he serves as a medical director for the Premier Pain Clinic here in Atlanta and is a strong advocate for the legalization and cultivation of medical cannabis. He was a contributing factor for Rotting Law HB 722 and its inclusiveness of peripheral neuropathy. Dr. Hodge currently is actively in Georgia, and he will be joining us shortly. But for now, we're going to be discussing Mr. Frazier. Tell us a little bit about yourself. I see we have Dr. Hodge on here as well. Welcome, Dr. Hodge. Welcome, Mr. Frazier. Thank you, gentlemen, for joining us for today's discussion on MS. So,
what's up, Stanley? What's up, bro?
How is it, my brother? You're looking good, sir.
You and the MS warrior, man. You got a better beard than me, brother.
Oh, man. Good morning,
Nicole.
Dr. Hodge. How are you?
Oh, thanks for having me, and apologies for being a couple minutes late. I'm sorry about that.
You're all good. No worries at all. If you don't mind, could you turn your camera landscape for us?
Sure.
That would help with our, just unlock your screen and turn it landscape.
My bad.
It's all good. No worries. We're so glad you're here. Thank you for being here. We really
What
are.
do you mean? What do you mean? Portrait mode, see?
Just unlock the screen. Like if you unlock it, there you go. Now we get to see you. Yes, there he is.
Yes.
There he is.
Thank everyone for joining us. Mr. Frazier, we're going to start with you. Tell us a brief description of your journey and finding about MS, and how did you find out that you were suffering from multiple sclerosis?
Yes, sir. First, I want to say, man, I'm grateful to be here, man, to be on with these guys, man, and this wonderful young lady, man. My journey probably started in 2008. I was doing construction. I was a finisher doing concrete. And one night leaving the job, I got this feeling in my feet, like feeling like glass, like I was walking on glass. My feet was on fire. And that was like the first sign of the multiple sclerosis. And probably that summer of 2008, I was going to pick up my daughter from school and got to the door of the school to pick her up, and my whole entire left side of my body completely went out. Standing there puzzled, don't know what's going on, can't use nothing on my left side. So I asked my wife for help. She came and helped me back to the car. And that probably was like a Friday. Going on to like the weekend, had all the kids at the house. And at my house, I have steps going down into the den. Going down the steps, my whole body just went out. So I collapsed, went down the stairs, fell down the stairs, got rushed to the hospital. They did a whole lot of testing on me. They couldn't tell what was going on. So that was in 2008. I didn't get diagnosed till 2010. 2010, they did they all the tests that they did came back negative. 2010, they did MRI of my brain and seen all the lesions on my nerves and stuff. So that's when I found out that I had multiple sclerosis. And between going through that, going to the doctors and all that, they couldn't tell me what was going on. I had symptoms of like a pain to run from my left leg all the way up to my left arm, and my left arm would just fold up by itself. So these was the symptoms that was going on. And also in 2010, I couldn't use the left side of my body, so I had to learn how to walk again. I had to learn how, to just really deal with it, cope with it. And at this time, I wasn't even using cannabis at all. I wasn't using cannabis at all. Probably I moved to Georgia 2011. And 2013 is when I started back using cannabis. So
let me ask you this real quick. So between 2008 and 2010, when you finally got diagnosed, how many different doctors did you have to go see?
I probably seen at least 4 specialists. And couldn't nobody tell me what was going on. And I met this little young doctor. He probably was 28, just became a doctor. And he was gung-ho. You know what I'm saying? I didn't have no insurance, so he treated me like a real patient, and he was real concerned. And he just stayed on it. He sent me to a specialist in UAB. Was his friend, was an older doctor. And he was the one that really told me what was going on with me.
Wow.
Yeah.
Wow. And when you moved to Atlanta, or started using cannabis in a state that did not allow cannabis as medicine at the time, how difficult was that for you to try to find and navigate medicine? Like, what did you do?
It was very difficult.
It's why I left Georgia. Like, finding
I'm gonna tell you what happened, because one day, like I said, I woke up and I couldn't get out of bed. I was in so much pain.
Right.
My joints was locked up. I was just feeling real bad. I was fatigued. I didn't feel like being bothered. And I was telling my wife, and she went and found me some Girl Scout cookies, and I used the Girl Scout cookies, and probably 30 or 40 minutes later, I was up, moving around, able to, to function a little bit better. So I started studying the cannabis. I started going out to Denver, finding different strands that work for me. And that was my journey right there. I started, cooking with it, which was better than smoking, because it gave me a longer.
Longer, right.
Yeah.
Right. Yeah.
Longer.
And that's That's what the modality of consuming cannabis by digesting it does. Now, it might take longer for onset. So it might take anywhere from 30 minutes to 2 hours for it actually to kick in. But once it does kick in, it stays in your system much longer than when you smoke it. So maybe it could stay in your system anywhere from 6 to 8 hours. And so a lot of people with debilitating diseases like an MS or like lupus, these autoimmune disorders, they prefer to use a digestible option because smoking it increases the mucus in your body. And it, of course, can have some other adverse effects. And so digestion is one of the most popular forms for autoimmunes. Wow. Thank you so much for sharing your story.
Yeah.
So ladies and gentlemen, that's from a patient perspective, which a perspective oftentimes we do not get because many patients don't want us violating their privacy or their HIPAA. Now let's go to the other end of the spectrum, to the clinical side with Dr. Hodge. Dr. Hodge, I know that you have been a key figure here in Georgia. You know, you've helped me, you've helped other patients just out of the kindness of your heart. As a physician, what was your motivating factor to get you into alternative wellness with a special focus on medical cannabis for a variety of conditions? What led you down this pathway?
Unmute, Doc. Unmute, Doc.
I got it. Thank you, Stanley. What really, honestly, is it's like when I broke my neck in 2012, like it wasn't, like I had great bedside manner, Stanley, but until I became a patient, like in the snap of a finger, and until I realized what opioids really do to you and what benzodiazepines really do to you, and that's the Ambiens, the Xanax, the Valiums. I didn't realize I was participating in the healthcare system that approached medicine systematically versus comprehensively. So when I was thrown into this healthcare system and I saw my neurologist, and my neurologist told me, "Hey doc, how you feeling?" I'm like, "Bro, thanks for putting plates and screws in my neck, but I'm in terrible pain still." And then I hear, "Hey, you're not in the chair and you're still alive." And it infuriated me. If I could, I would have slapped him, but he was the type that would probably tell on me, you know, and I go to jail. But I was humiliated and I was belittled by pharmacists. I was belittled by my ortho, and I mean belittled, you know, like, hey, I'm going to pick up opioids every month, and they look at me like I'm seeking, or, you know, IDs, and looking at me like, well, you look good, and they don't understand nerve pain. So it was just a lot of frustration. It was a lot of like, look, I've been practicing medicine the wrong way. Medicine should be mind, body, and soul. We have keep perpetuating this stupid idea that one size fits all. We're all going to have different adverse events from an opioid or from cannabis, any drug. And we got to really bring home the point that all drugs can become poison. So I felt it. And that was my main reason for becoming this cannabis enthusiast, for, you know, making cannabis recommendations for the state. This was my main reason when it wasn't popular to do it, because I became severely depressed by it. And I didn't want people to feel a day of what I felt. So do it. You got to MD, make a change.
Yes, sir.
That's it.
And ladies and gentlemen, I genuinely have an appreciation for Dr. Hodge, because here in Georgia, as you know, this is the South. This is the Bible Belt. So even talking about medical cannabis or promoting medical cannabis as a form of medicine was very taboo. It's become the popular thing, the cool thing to do. But when Dr. Hodge started, I know when I first started, it was not. And I was going down to subcommittee. I think it was probably like 2016 or 2017. Walking up to the steps of the cover, and I heard somebody say, Cannabis. And I looked back, and it was Dr. Hodge. I had followed him online, but I didn't know he followed me back. And he was like, "Man, I've been watching you." And it really felt good, because that was one of my, I think, the second time I ever testified down there. to see a person that look like me, ladies and gentlemen, because oftentimes when we see these medical cannabis programs and these physicians and these patient advocates, they don't often look like us. So it was really reassuring for me to see someone that looked like me, that supported what we were doing, and that was also a physician. So my next question, Mr. Frazier, you got something for us?
Yeah, I also want to say, man, they had me on 15 prescriptions. 15. I met Dr. Hodge in 2017.
Tell it.
And man, he's been a blessing to me, man. He changed my whole life, man. Real
Thank
talk.
you. You changed mine too.
Thank you,
Mine
bro.
too, for sure.
And I just want to add on to that. I met Dr. Hodge and I met the Cannamedic while I was advocating in the state of Georgia for patients to have the right to use medical cannabis. And it was professionals in that arena, because we knew each other as soon as we saw each other, because we were the only Black people. I mean, there were a few others, and thank God for them. But it was so satisfying to know that we as you as medical professionals were willing to leave your comfort zones and leave the protection of your offices or your licensing to step out and make public statement and testify in front of our Congress and explain to them why it was so important to legalize medical cannabis in the state. And so thank you to you both. Being
all of y'all, all of us.
Yeah. It's so
all of us.
All the way around.
Stanley is both of you, because Stanley was and I know we got to get to MS, but the advocacy is the most important thing we still got to do. And Stanley was every state has a Black caucus, but they're usually baby boomer age, and because cannabis has been so negatively stigmatized, they're signing laws that are writing us out. And Stanley has been instrumental in trying to get us involved more than just 2% of this $38 billion market in 6 months. So Stanley, I salute you. Thank you so much for what you do and the direction you give others. And a lot of times those guys are older than me and they're slowly trying to understand. And for states that for the other 12 states that don't have a medical program, Black Caucus, get in touch with Stanley before you sign and vote. Very important.
Very important.
Thank you all for that.
Yeah.
I tell people advocacy doesn't pay, but it does pay off. And with that, Dr. Hodge, from your experience and from the clinical side, the legislative side, what was the direct correlation that you saw for cannabis, for MS patients, in lieu of some of the pharmaceuticals that these patients are being prescribed? What were the results where instead of the synthetic medications versus the medical and the natural oils and tinctures and things of that nature? What was some of the things that you saw right off the bat, and how medical cannabis helps MS patients?
Well, evidence-based medicine, and it's right. It's hard to find evidence-based medicine on multiple sclerosis with cannabinoids or any cannabinoid formulation. The best evidence is for their number one symptom, that's spasticity, painful spasms.
Yes.
Painful spasms lead to dysmotility. Dysmotility leads to contractures, and it leads to bed sores, sepsis, and now they're terminal. Most of my MS patients I saw originally in my early career was hospice. Multiple sclerosis is a terminal disease. And I would see them in stage, feeding tube, contractures, looking like cerebral palsy. Cerebral palsy is like when you're born with. These are old people, with end stage, and you would offer them just relieving medication. So spasticity prevents those contractures. Spasticity causes falls. So he's at anyone with MS is at a risk of a fall, and falls kill.
Yes.
Stanley, you've been a medic. Firemen are picking up falls all day, every day, all day, in every city, every town. Someone falls and has a bleed in their head, and it's a matter of minutes. Or they had a fall, they broke their humerus, they broke their knee. You see it all the time. Firemen are just not putting out fires, So they're at high risk for falls. They also have a bladder that just won't quit at night. And that causes insomnia. Sleep is one of the most important things we can do naturally, especially if you have a chronic autoimmune disease is sleep. You know, it's inflammation, a lot of cortisol all day, every day, right? So when we sleep, that's when our natural endocannabinoid system, our natural opioid system, those endogenous opioids and those endogenous cannabinoids that we can talk about, that you guys, I know you talked about already, they come out at nighttime, doing a lot of good and stopping inflammation. And to talk about the Cd1 receptor, we have over 750 receptors in our body, in our brain. Now, these G protein receptors is why we prescribe drugs. These drugs, everything we prescribe will stick to a receptor and upregulate a signal or downregulate a signal. That's just how drugs work. Now, for everyone listening on this podcast, the endocannabinoid system, the Cd1 receptor, right, which is responsible for psychoactivity, right, which is the most predominant G protein receptor in your brain. Why? Because it regulates cognition, it regulates motor skills, it regulates your mood. It's the most dominant G protein receptor in your brain. And it blows my mind to tell y'all that. That's how important it is. You dig what I'm saying? So that's what cannabis can do. So what I found out personally, when I use cannabis and I get like my ECS is super activated, I will sit at the commode, right? Just sitting there waiting for my bladder to spasm. I feel like I need to void.
Right.
So I'm telling people like, look, I'm like, hey man, you had this prostate procedure. Yeah, your cancer is cured, and now you're in a diaper. I'm telling people, when you use cannabis, you get to the point of almost cannabis intoxication. You might have an urge to go, you don't go. And I'm sleeping 9 to 10 hours at nighttime now. So
and that's by using and what forms of cannabis? Like I mean, everybody can't necessarily smoke. Maybe is it a CB dominant type of tincture that you're using?
I'm talking THC hot. Like I'm talking like I'm stoned. You know, like I am super psychoactive. And when I get to the point that my ECS is super activated, not to the point of cannabis intoxication.
And what is that border? How do you know if it's cannabis intoxication or if you are medicated to the right level?
Great question, because there's disorders that are associated with cannabis, and that's the DSM-5. The DSM-5 is made by psychiatrists, and every mental disorder that's using, also addiction, is in this DSM-5 criteria. So there's cannabis intoxication is real, cannabis intoxication with delirium. Now and you say delirium is such a bad word. Delirium is slurred speech. Delirium is, hey, I was about to do something and it felt like something was moving. Delirium is talking slow, so be careful. If you admit to slurred speech, if I witness that, I'm not going to say he was talking slow, Stanley. I'm going to say Stanley is experienced delirium. So there's cannabis intoxication, there's cannabis intoxication with delirium. There's a disorder called cannabis withdrawal. Now, also, there is cannabis, we don't say addiction anymore. There's cannabis use disorder. There's cannabis psychosis. There's cannabis associated delirium. And there's also cannabis-induced sleep disorder. So those are 7 conditions. And, you know, cannabis is all about the good, the bad, and the ugly. But at least we're starting an industry or a sector that is honest. You know, we're telling people, hey, look, there's the good, the bad, and the ugly. We're telling people, hey, my ECS. So it doesn't matter what I'm ingesting because I have a unique ECS.
That's right.
That's different than yours. It's different than Stan. It's different than Mook's.
Right.
So all we can do is advise people, hey, based off this chemotype, based off these terpenes, based off these flavonoids, these are results. And we know now that and again, there's no lethal dose with cannabis.
Right.
Yes.
So every drug that anyone with MS and caregivers pay attention. You guys you're the one that giving your loved one picking up these prescriptions.
Right.
That those adverse events are real.
Yes.
And then there's serious events. And every one of those drugs have a death. They have organ failure. They have chronic kidney disease from.
Right.
And with cannabis, there's no lethal dose. So it's very important that my caregivers understand that.
Thank you for that, Dr. Hodge, because oftentimes in this industry, I get a lot of pushback from other clinicians because they're like, oh, you guys are saying that cannabis is the end-all, be-all medication. It's going to cure everything. No, I tell everyone it is a resource in your toolbox of wellness. And another condition that I do want to touch on, because we are seeing a rise in cases of this, and I'm seeing media outlets such as CNN reporting this, and that is CHS, which is cannabis hyperemesis syndrome. And it is real because your body can only process so much THC. And oftentimes when people are taking excessive amounts of concentrates or what they're using, they don't know where it came from. It wasn't clean. We're seeing the vomiting, we're seeing the diarrhea, the abdominal pain. So please, people, understand that too much of anything can have adverse effects. And with that, I want to go back to you, Mr.
If you're living, also, let me add to that. And if you're living in a state where it's not legal to have cannabis or use cannabis, you don't have a regulated facility to walk into where you know that the cannabis you're buying is been tested for metals, for bacteria, for mold, for anything else that might be on it. What you're getting from your local weed man is not necessarily considered medical, not necessarily, it is not considered medical cannabis because it hasn't gone through the proper protocols and testing to deem that it is safe for consumption.
Very important.
So keep that in mind when you're living in a state that is not legal, that you're buying cannabis from an illegal marketplace. And that means that it could possibly have much more adverse side effects, especially for a patient that is trying to use it for their autoimmune disorder. So just please keep that in mind, folks that are living in a state where it is still not legal. If you can afford to, get yourself to a legal marketplace like a Colorado or a California or Nevada. And then also keep in mind, Dr. Hodge.
Do it yourself. Make it yourself.
Or also, and I think a state that's closer is Florida, but Florida does not accept Georgia medical cards. But the other thing that you want to keep in mind is when you do decide, if you decide to visit a state where it is legal, keep in mind, Dr. Hodge mentioned terpenes and flavonoids. There are some states that don't test for terpenes. We all know that the best flower comes out of California, the best, but they don't test for terpenes. So when you're considering visiting a legal marketplace, take those things into consideration because terpenes have a tremendous effect on how your body feels. It has physical effects on how your body feels. So just because you're used to buying Girl Scout cookies, like Mr. Frazier mentioned earlier, you buying Girl Scout cookies in Georgia is not the same as Girl Scout cookies in a California or a Nevada marketplace, in a legal regulated marketplace. You're going to be more in depth about what is in your flower when you're buying it from a legal marketplace. And therefore you can decide what cultivar strains is what the cannabis community calls it, what cultivars work better for you.
Right.
Absolutely. They are not, again, ladies and gentlemen, not all symptoms are the same, not all patients are the same, and not all strains are the same. And that leads me into my next question for Mr. Frazier. Mr. Frazier, I know that you recently celebrated your 100th infusion at the Shepard Spinal Center of Atlanta. I want to commend you for that. That is very proud. When I saw it, I was like, oh my God, like, man, that's a warrior. So for anyone who may be watching this, who's a caregiver, an advocate for other MS patients, or even an MS patient themselves, Tell us how your usage of medical cannabis as with a polypharmacy approach. And again, people, polypharmacy is using more than one modality to create that wellness and that healthcare. How has your usage of medical cannabis helped you in alignment with your treatments at the Spinal Center, the Shepard Center of Atlanta?
Well, it helped me a lot, man. My mobility, my pains. I used to get these thing called MS hugs. And it just feel like somebody's just bear hugging you. And once I use my cannabis, I'm able to cope with it. I'm able to deal with it. I have real bad depression. Cannabis helps all the way around, man. All the way around. Just dealing with it, coping with it, and even with the pain symptoms. It helps me all the way around.
Could you let us know a little bit more about these transfusions? Are they blood transfusions? Is that what? Immunomodulator treatment. Okay, what is that? Can you explain that to us, Doc?
Explain it, bro. Explain it, man.
What they're doing, they're running the medicine through my system. Yeah.
So this is something like chemo. This would be similar.
No, it's an immunomodulator that's supposed to protect the myelin sheaths, you know, and stop the degeneration of myelin sheaths. So the pre-synapse and the post-synapse can talk. But what's the bad thing, caregivers, is a lot of the medications that Mook is talking about, there's a criteria for, you know, if you're pregnant, you shouldn't do it, or if you're a female, or if you're early MS, it's for adults. Cannabis is something you can start day one.
Right now. Right.
Day one.
Right.
Pregnancy, contraindicated, you know, lower birth weight. But it's not 12 other things if you were to use one of those pharmaceutical drugs while you're pregnant. Right. You know, I can tell moms, hey, there's a chance that there might be a low birth weight. What's low birth weight? Hey, it'll be less work for you, mama. Easy. Easy. No one's going to a withdrawal, neonatal withdrawal,
right?
Like the other babies that are opioid and dependent.
Yes. And let me ask you this.
Also, benzo. Go ahead.
Let me ask you this. My dad was an OBGYN and infertility specialist, and he was also a Rastaman. And so when his patients came to him and said that they were consuming cannabis, his recommendation was for them not to smoke it. He knows how much it helps with nausea, but his recommendation was not smoking it, but to make it into a tea. Him being an island man, that was a common thing, even amongst Rastafarians. Yes, they smoke it. They also use it as a tincture or a tea. And so would that be something that you would say for a pregnant woman that is suffering from multiple sclerosis, giving her the option of, instead of smoking cannabis, to maybe steep her flower?
Concoctions, yeah. You know, concoctions is boiling a plant and boiling out the goodies. So those concoctions, tinctures is with alcohol or another extraction method. Definitely, you know, definitely I would say go for it. You know, DFAX is not knocking on your door in Georgia for that. You know, they're just not, you know, because you're going to have some leftover pills that you didn't flush, and maybe your baby gets into some Phenergan. They'll have way more problems dealing with Phenergan than that gummy, you know? Right. So,
absolutely,
you know, there's way, and let's talk about the calls to poison control. Okay.
Right.
It's not cannabis.
Not for cannabis.
It's not cannabis. It's Motrin. It's fat burners. It's caffeine products that people use. They're drinking too much. And those are accidental exposures. Mm-hmm. Okay, kids. It's pharmaceutical drugs.
Right.
You know, it wasn't until the 70s that the feds started protecting kids, making our medication childproof. Mm-hmm. So I can go on and on. when we talk about cannabis and being Schedule 1, and again, Cd1 receptors, cannabis will hit your Cd1 receptor, and unlike other receptors. It works before and after the signal. So it's great for down regulating pain, down regulating inflammation. Hey, stop with the stress. It down regulates it, but it also can upregulate what we need. Hey, cells don't die. That's
right. That's right.
I see there's viruses right here, there's bacteria, but stop dying.
Yeah.
And it will down regulate that message. Right. And that's why it's a moon booster. Right. I mean, and the acids, it's just the beginning. Like the acids, the THCA, the CBDA, the THCV, the other non-bioactive cannabinoids. That is the future, and it's coming soon.
Coming soon.
The research has been minuscule.
And if you have any, and our audience, if you have any questions for the lovely Dr. Hodge or our lovely other guest, Mr. Frazier, who is an MS patient, please post it in your comments. We would love to be able to answer your questions. Stanley?
Absolutely. So ladies and gentlemen, everyone attending, this has been a discussion about multiple sclerosis. And as you've seen, if you've been following us all week, we started out on Monday. We've talked about conditions from sickle cell, which is a disease that affects predominantly African Americans. And that led us into a discussion regarding lupus, because we know that lupus disproportionately affects persons of color, especially in women. If you go back to watch some of the previous episodes, yesterday we discussed rheumatoid arthritis, because all these conditions are different, but they all affect us and affect our quality of life. That led us into today's discussion regarding multiple sclerosis. So, ladies and gentlemen, you're seeing a wide spectrum of disease processes in which medical cannabis may be an effective treatment in your regimen for maintaining quality of life. At no point this week did we say, hey, if you smoke a joint, you're going to be cured, you're going to be healed, because many of these disease processes, there is no flat out cure. But if we could make the symptoms of these conditions more manageable, then we are doing our part. And I want to thank everyone for being a part of this discussion. And one point that Dr. Hodge talked on, and he dropped a word that many people may not understand when he said the myelin sheath. That's part of your nerves. So your nerves, so imagine this cord as a nerve. And for us, we're just looking at a white cord. Oh, that's your nerve. If I take this cord and slice it this way and this way, we're going to see different cords inside of this. We're going to see this is a protective coating. So imagine the white part of your phone charger as your protective coating. With multiple sclerosis, this becomes damaged. And when this becomes damaged, it affects the signal being sent here that you're using to charge your phone to where you're getting the power from in your brain. There have been several research studies that have shown that CBD and cannabinoids have potentially shown the ability to repair and prevent further nerve hurts. And so far, it is one of the only substances on the planet Earth that have helped to regenerate and heal damaged nerve tissue. This is why NFL players are looking at this for concussions, for spinal injuries, and we're seeing patients who actually show improvement when doctors and neurologists were saying, well, nerves damage, it's over, it's permanent. Well, as Dr. Hodge said, that myelin sheath, that protective coating is what cannabis is helping to lubricate. It's helping to coat your coating. So ladies and gentlemen, please, if one doctor tells you nothing's going to help you, please find another alternative. I know that Dr. Hodge has assisted countless patients here in Georgia. I have taken him patients, and he stopped. Mr. Frazier's a patient. And I see we've got a comment from Mr. Leonard Phillips. It says, I need facts. Been smoking cannabis often and on for 71 years, and I had bladder cancer, and they say it came from smoking. Actually, what is really good for you?
Huh. Great question.
Yeah, it would be hard to tell the origin of your cancer, blame it on smoke. And it's easy to do that. Right. It's easy to do that. So I wouldn't say cannabis. Cannabis does create smoke. I mean, if you inhale cannabis with with a J or a blunt, it does create smoke. That creates tar. But if you look at the studies, that cannabis is not associated with cancer like nicotine and tobacco is associated with cancer. Absolutely. And for my folks that are inhaling and worried about COPD or emphysema or chronic bronchitis, look at the studies. Chronic smokers of cannabis, not tobacco, but if you want to compare chronic cannabis smokers versus tobacco users, I'm talking cigarettes and cigars, our FEV1 and FDC is better than the normal population. Ours goes all the way up. That means FEV is how much I can my expiratory force, and FEC is how much air I can inhale, how much I can take in. So for chronic cannabis users, we go up. And for tobacco, they go straight down, baby. They go straight down, emphysema, carrying oxygen tubes, nasal cannula for the rest of your life. Right. So be careful of associating, or when a doctor tells you something, because he or she may be talking out the side of their ass.
Right. And we have to keep in mind that tobacco lobbyists have a lot more money and resources than cannabis lobbyists. Okay. The cannabis lobbyists are doing it for free and for the passion and for the love of the patient and for the love of the plant. They don't have the same resources that tobacco lobbyists do. And you also have to take in consideration those doctors that are quoting you these facts about how cannabis can be harmful or just as harmful as tobacco. You have to consider the studies that were done. Were the studies that were done around cannabis, were they asking the patient if they were consuming cannabis inside of tobacco? Because that's what is most commonly happens, especially in our community. We smoke cannabis inside of a tobacco leaf. We know how poisonous and how toxic tobacco is. And so if we are putting our cannabis inside of a tobacco leaf, it's kind of counterproductive. To get yourself a glass. Get yourself a glass apparatus. That's the best way. If you have to smoke, if that's the best way for you to get the medicine, consider moving from papers, or unless they're hemp papers, consider moving from tobacco wraps and cigars into a different apparatus to consume your flower. I use a machine called by Da Vinci. They're a company that has a machine that allows you to vape dry flower. It allows me to control the temperature of the flower that I'm vaping, and I'm not combusting it. I'm not setting on fire. It's getting put into a ceramic oven and heated up. And I inhale the vapors that come off of when it gets baked, essentially, not on fire. And so those are some of the things that you want to consider if you're really using cannabis as medicine and want to get the most medicinal benefits from it. Think about different and other apparatuses that you can use that don't involve using a tobacco wrap, any type of cigar wrap to consume your medicine.
Also, to Nicole's point, so people smoking and vaping are two different things, and there are multiple ways to vape. When people think vape, they think like the vape pens that you see people with. This is a regular stylus pen, but you see people with the vape pen, and there's a concentrated oil or liquid in there. What we have to understand, what is smoke? All smoke on the planet Earth, whether it's a volcano, a house fire, or a cigarette. Smoke is unburned particles of combustion. So smoke is actually solid items, but they're lighter than air, so they float, which is why people who smoke indoors, you can wipe a counter and sometimes find that residual smoke. So sometimes vaporizing, ladies and gentlemen, is a lot better, a lot cleaner. Now, before we wrap up, I want to make sure that we give as much information as we can. Dr. Hodge, I know that you have your own product line here in Georgia, and it can be attained in person and online. Tell us a little bit about your product line and where can people purchase some of your products here in the state of Georgia, and for anyone that may be watching abroad.
Anyone abroad, holistichempgeorgia.com. We ship out. I have several CBD formulations. One is a focus. So my folks with ADHD or just need any help with getting up in the morning, help with thoughts, get help with organize. If you have a little bit of pain, you have a little bit of anxiety. I have a line called Focus in the morning. I have something for a sleep aid at nighttime. The terpenes are obviously terpenes, like lavender, has linalool in there. It has some other proprietary terpenes in there, and that's called Unwind. I have some vegan gummies. So, you know, it's hard to get young children to swallow pills. The gummies, you know, so for my caregivers that have small kids that can't swallow pills that can benefit from CBD, I have gummies, or yourself. I also have a topical cream. We have Cd2 receptors in our skin, which respond to CBD cream and all the benefits, and it can last up to 10 to 24 hours. Of course, our CB2 receptors are transdermal, and topical applications can't penetrate that far, so they will never get you high. So be careful. Don't spend your money on $100 on THC cream, thinking you're going to get high from it. No, it doesn't penetrate where your CD1 receptors are. You can follow me on RashaanHodge.md, HolisticHempGeorgia.com, again, to order the goods.
Yeah.
Order the goods. And one last thing. After breaking my neck, I had my disc exploded backwards, and it squished my cord. So similar to what MS patients are having, I'm having demyelination. So I was offered in immunomodulators and stick my arm out, you know, and I was to each their own. I decided to do my research and protect my myelin sheath. Thank you, Stanley, for bringing that home. So I suffer from similar symptoms of MS patients and just use cannabis oil solely. Edibles, I use all type of formulations and all types of delivery methods. I even use suppositories. I even use my rectum.
That is arguably one of the most taboo, but in my opinion, that is one of the most effective. You know, we mentioned that the other day. I started using suppositories last year because with my GI conditions, I realized smoking wasn't touching the pain. The topicals couldn't reach the pain, and there was nothing that was helping. The tinctures, they aided a little bit, but once I used the suppositories along with the tinctures, it provided enough relief, and it got me through a whole month of using them till I could get to corrective surgery on New Year's Eve. So again, ladies and gentlemen, you can eat it, you can smoke it, you can inhale it, you can rub it on, and you can even insert it rectally or vaginally. And before we get out of here, Mr. Frazier, please tell everyone how they can follow you and keep in touch for, you know, your motivation as an MS warrior.
Yes, sir. I'm Philanthropist Frazier on Facebook. You can follow me on Instagram. The fam is first. I'm sharing my story on there. You know, you can follow me, man. And hey, I'm just having good vibes, man. You know,
bro. What about your baked goods? And tell them how to get your baked goods and your infusion dinners. Yes,
we do it all, man. You know,
tell them.
Thank you all. This has been.
Thank you.
Would suppositories be better for sciatica? Miss Webb, I can't say whether it be better or worse, but what I can tell you is I would advise you to try some. Because the worst you can say is, well, it didn't help, it aided in something else. I would always say give it a try, but make sure before you insert something into your body, make sure it's from a reputable source, a clean tested source, and a source in which you can reach out to the company and get information about these products before inserting them into your body. But I would recommend trying them. Dr. Hodge, you got something you want to add to that?
I did, because Nicole mentioned that she likes vapes. And again, there's the good, bad, and the ugly. Those metal coils, those coils that heat up because you're not using a flame, you know, you got to use metal coils. They shed a lot of metal, heavy metals. Mm-hmm. So make sure my vape users don't. And plus, the vape machines can go from up to 800 degrees sometimes.
Don't do that. No.
So it changes those additives. To make cannabis soluble, you got to use cutting agents.
Right.
Heating those cutting agents higher than 600 degrees turn them into carcinogens. Right. Even though they are FDA approved. They're only FDA approved for perfume and to put on food, not to heat up.
Consume.
So,
and
I also have to tell my vape users, Avali, you know, that's vape associated lung injuries, a new diagnosis since 2018 from vapes. Okay. and it's supposed to be from vitamin E acetate, the cutting agent, from battery, metallic acids. So that's why I kind of avoid vapes until we can get them safer.
I was not recommending vapes. I was recommending.
I didn't say you were.
A dry flower vape.
Don't you backpedal. Even dry flower vapes. All vapes. Mouthpiece, a heating device. The heating device sheds nanoes. It's coils.
It's ceramic. So this one is the one that I use is ceramic. So it's made out of glass, not metal. I make sure that.
Still heating coils.
But I definitely there are different apparatuses out there, you guys, for you to use, and so there are different options.
Right.
I don't vape oils.
Hey, what about Philip Morris? Big Tobacco has patented vape devices out already.
Yes,
already FDA approved with two pods, one for nicotine and another for cannabis. So don't let them fool you.
Right.
Big Tobacco has already got FDA patented vape devices.
Absolutely. And I tell people when they ask me about these different modalities, I never recommend oiled vapes because there's just so much that we don't know about them. And so, and you're absolutely right, Dr. Hodge. Make sure you're checking these make sure you know what it is that you're consuming and putting in your body and the modalities that you're putting in your body. When you smoke those vapes with oil that are concentrates with oil, you don't know what those other oils or those other sources are and what the damage that they might do to your body. So
the cut.
That's right. That's
So,
right.
ladies and gentlemen, this leads us to the end of today's episode. Again, I want to thank you all for attending the Minorities for Medical Marijuana Health is Wellness Day 4 discussion on multiple sclerosis. I want to take a special thank you to our colleagues and our guests, Dr. Rashaan Hodge and Mr. Philandris Frazier. And remember, guys, the information is out there. Look for it. Get a second opinion. There is always an alternative to every medication. And if there's any questions you may have, any additional information or support that you may need, please feel free to reach out to us. Minorities for Medical Marijuana. We are on every social media platform. Thank you to Nicole, my co-host, who's done an amazing job this week, Nicole. Today was a very special episode because I really want to bring some hometown heroes on here today to help drive this information home. And you're not going to want to miss tomorrow. We bring back on Chef Nico to discuss diet and foods for your wellness. So again, thank you for attending the Minorities for Medical Marijuana Health is Wellness discussion on multiple sclerosis. Thank you all, and please stay tuned for more.
Thank you all. Have a good one. We'll see you all tomorrow for fibromyalgia.